just wanted to extend our deepest gratitude to Senators Blumenthal and Murphy for coming here today and making everyone aware of their support for our congressional directed spending project, which is entitled Improving Mental Health Care Access and Equity for Connecticut's Children. The Connecticut Council of Family Service Agencies is thrilled to receive this award and to deliver it to Connecticut's children, up to 900 children through our various programs here. The Connecticut Council of Family Service Agencies is a membership organization comprised of 14 agencies throughout the course of Connecticut. We cover the whole span of Connecticut, and we will be serving children, screening children for mental health issues at a young age, and hopefully catching them before things get too far down the line. So, Senator Blumenthal, thank you very much for your support. Senator Murphy, you as well.
Thanks. Let me thank my colleague, Senator Murphy. He and I have worked together on this issue of mental health. It is a long-standing mission for both of us to provide more insurance coverage, more treatment for mental health issues. And I want to express my thanks to the Connecticut Council for Family Services. It is a statewide organization with members literally in every town and city, every major town and city from Greenwich to the northeastern part of the state, because this problem knows no geographic boundaries. Mental health illness is an illness. It is an illness as much as broken bones or cancer or any other physical affliction. And the whole purpose of this grant is to catch problems upstream when they may be more minor, before they have really bad consequences downstream. More than half of all mental illness begins and can be diagnosed by the age of 14. Think of it for a moment. Almost all of the major mental health problems by age 24 are evident, 75%. But at that earliest age, before 14 years old, kids can be screened and identified and treated and helped before they become harmful, potentially dangerous to themselves or others. And that is a gift that really is of almost priceless value. This $370,000 will enable 900 kids to be reached and helped before their mental illness becomes potentially disabling and dangerous. That is a major breakthrough in public health, but it's only the beginning, because there are certainly more than 900 kids who can be helped in this way. And so this $370,000 is a wonderful beginning, a real breakthrough, but it is only a beginning. The community health workers involved in this effort will be increased in number, but also in training. Very important to understand the screening and identifying of these kids who are potentially at risk. They will be looking for kids who are at elevated risk. That task is by no means simple or easy. They will be trained for it. The community health workers will be given that kind of skill training that is critically important to the goal of identifying kids. And then they can guide those kids to mental health services. Obviously, we need more mental health services. We need more care, counseling, and treatment. That is also part of the next steps that need to be taken. But this $370,000 is a congressionally directed spending that Senator Murphy and I felt so deeply about getting at this stage so we can get started on potentially a new era, literally potentially a new era of identifying, screening, and helping kids at the earliest stages of their mental illness. They deserve it, just like you would take preventive steps to identify any other illness at an early stage before it becomes more serious, before the consequences are dangerous and potentially even deadly. And so these community health workers will literally be helping to save lives. And mental illness has far-reaching consequences that this program will help to forestall. Disabling at work, potentially domestic violence, other kinds of disruptive or potentially violent behavior, and obviously linked to gun violence. So we're going to continue working on this effort, but for right now, it's a really very dramatic and important step in the right direction. Senator Murphy.
Great. Thank you very much, Dick. Bob, thank you to you and your fantastic team for bringing this proposal to us. When Dick and I looked at it, this was a no-brainer. Investing in kids right now, while we are still in the middle of a pandemic that has really been damaging to our kids and our students, just made an enormous amount of sense, and we're really glad to be able to deliver this funding to the program. It was a priority for Dick and I to get this included in the budget, and I think Dick explained very well why this makes a difference. We've seen an explosion in the number of kids in mental health crisis during the pandemic. You go to any emergency room in this state and they will tell you that they have never seen the numbers of children showing up in crisis than they have in the last 2 years. Dick gave you one data point, I'll give you another. Last year we saw a 50% increase in the number of teenage girls trying to take their own life. Suicide attempts increased by 50% amongst teenage girls. The spike wasn't as big amongst teenage boys, but it was still significant. That's a stunning and heartbreaking number, and it tells you how many kids are out there living in crisis. The genius of this proposal is that it seeks to get to kids before they're in crisis. There are lots of kids out there who are living in very vulnerable situations, who are showing the signs of serious mental illness but can't find services. And what this program does is it goes out to existing programs that the council's members are working on and screens these kids who tend to be lower income, more vulnerable children for the early signs of mental illness, and then helps them make that connection to mental health providers. And that screening process is important, but so is the process of making the connection, because our mental health system is like a Rube Goldberg portrait. It's so hard to find somebody that will serve your child that many parents might know there's something going on, but after they make a few phone calls that go nowhere, they give up. So what this program is going to do is screen those kids and then get them on the path to getting help, and that's going to save lives. It really is going to save lives. So we're really glad to invest in this partnership's launch, in this program's launch, and we're really eager to track its progress because, well, this is going to serve nearly 1,000 kids. That's a lot. There are tens of thousands of more kids in this state who need the service. So one of the great things we'll be able to do is get some data back from this, get some experience back, and be able to argue to our colleagues and argue to the administration that we need to invest more in this kind of screening and early identification tools. So again, Bob, to you and your team for conceiving this idea and bringing it to our attention, we really appreciate it, and we'd be happy to answer any questions.
Any questions?
Can you clarify again where the money's coming from? Is it part of the state budget? Or?
This is the federal budget. So this This is what's called called congressionally directed spending. So in the budget, there are thousands of line items that we fight for programs in our state. And we get lots of applications from the state for congressionally directed spending. We have to sort through them and find the ones that have the most merit and the most impact. And so we were able to get a line item in the federal budget directing hundreds of thousands of dollars. I think the total is 370, directing $370,000 to go to launch this program. So federal money, guaranteed money. They have to go through the paperwork to get it, but the budget includes a specific line item directing the federal government to spend money on this program.
And I might just add, for many years, congressionally directed spending was impermissible. It was prevalent about 12 years ago and then eliminated. It's been reinstated now, but it's been reinstated with safeguards and a process that makes sure that every one of these projects passes certain criteria. But in addition, Senator Murphy and I work together. We collaborate on submitting these proposals. We do our own evaluation, which is painstaking. We went to law enforcement. We went to mental health providers. We went to community organizations who said, this state is in a mental health crisis. And one way to start solving this problem is to catch it early. Catch kids, screen them, identify them, help them before they become dangerous or potentially more serious in their mental health disorder. And so we're particularly proud of this one, and we are going to be following it closely because we'll have the option every year of doing this kind of congressionally directed spending. And mental health, after the pandemic, has to be a priority because the stress, isolation, anxiety, anguish of the pandemic has aggravated the mental health challenges of a lot of people, particularly young people who have been away from school, away from friends, away from their families in many instances.
If a parent or a guardian would like to seek help for behavioral services for their child, who should they call? Especially with this holiday.
They can call the Connecticut Council. They can call the Connecticut Council of Family Service Agencies, and we'll be happy to direct them to services.
Or there are organizations at the local level.
Bob, can you clarify the ages of the children again and how we're going to find out who to target here?
Well, it'll be children. We won't be doing early infant screenings, but typically ages 5 and above, school age. Yep.
And can you walk us through what those screenings look like and what type of services you'll need the connections to afterwards?
Sure. There's several broad screenings for mental health problems of any variety, depression, anxiety, conduct disorder, but also, in particular, trauma. As the senators have already said, the pandemic has really presented a challenge to our children, the children of the state of Connecticut. And we need to reach out to them, we need to support them, and screen them for again, broad-based mental health issues, but in particular also trauma.
You know, one of the sources of data will be the Victims of Crime Act. So talking about trauma, when kids see or experience some kind of criminal act, they may be traumatized by it. They may be, in effect, modeling their own behavior after what they see in the course of a criminal act, even sometimes by a family member. Domestic violence is one example where kids pattern their own behavior after what they see and experience in their homes. They may be victims themselves of domestic violence. And so the screening will go to a body of names already identified that will help in effect, identifying them.
And I would just also add that mental health also affects our physical health as well. And so the community health workers, in conducting the screenings and making referrals to mental health services and making sure that any and all barriers are addressed to accessing those, including transportation, any variety of things, child care. When you address those issues and the child has a better chance of staying in mental health, that will have positive effect also on their physical health. We know that trauma has, for many, many years, gone undiagnosed and unrealized as a field. And recently, we have really come to learn that early childhood trauma has an impact not only on mental health, but also physical health as well. And so again, this will have benefits for many, many years.
Can you provide some examples of some of the partner organizations that you'll be referring children to for services once they're identified as being high risk, and also what it means for a child to be at high risk?
So the agencies that will be providing behavioral health can be our member agencies, which span all the way down to Greenwich in Fairfield County, all the way over to the northeast corner of the state and throughout the state. If children need additional mental health services, we're there to provide them options and support to gaining those services. And your last question was about risk.
Yeah, I guess you mentioned before how that some student or children that you're going to be working with and identifying are kind of among those high-risk factors. Can you explain what some of those might be?
Yes, thank you for asking. So the social determinants of health are issues such as poverty, lack of access to transportation, lack of access to adequate nutrition and food, to living in an environment that has higher crime rates, and family systems that are characterized by domestic violence. And so it's these social determinants of health that help us to evaluate them and to get them in the child and their families into the services. So our current programs address issues such as the social determinants of health. Right? It's those children who are at risk here in the state of Connecticut. By screening them, they'll have a better chance to get the services that they need at an age that's earlier before it becomes more problematic.
So, kids, they'll spend a lot of their time with their teachers, throughout the year, throughout the week. Will this is there some plan to help, teachers be able to notice when a kid has, something bothers them that can be, problematic in the future?
I mean, this, so Dick and I have been working for a long time on this issue, which is bringing mental health first aid into our schools. That's sort of the term of art, which is that we give all of our teachers access to a set of screening tools that allow them to pick up on kids' behaviors that are showing early signs of mental illness and then help to get those kids into services. I don't know that this program will be in schools. I think this program really is more about identifying kids through outside of schools that may be at risk, screening them through those programs, like Dick said, those who have been who've been victims of violence or witnesses to violence. So that's important as well, getting kids access to services through schools, but this is not a school-based program. This is looking to help kids that are already involved in certain social service agencies outside of the schools.
Thanks, everyone.
Senator, can I ask one more question?
Sure.
I know we've been speaking a lot this week about Uvalde and Sandy Hook, and you guys have been fighting for common sense gun laws for a while now. One of the big counter arguments to those laws for people that oppose them is it's a mental health crisis. It's not a gun problem. Is this kind of a way to take a holistic approach to these mass school shootings that we're seeing and address the gun legislation issues and the mental health element of it?
Well, as I said, walk into any emergency room in this state and you will see the scope of our mental health crisis and our crisis of lack of access. We should fix our broken mental health system because it's the right thing to do for parents and children and families, period, stop. I've been pretty clear. I think that it's unlikely that fixing our mental health system is going to have a big impact on our gun violence problem unless we also change our gun laws, because there's no evidence that the United States has more mental illness than any other nation. There's also no evidence that we spend less money on treatment in the United States. The difference is here, somebody that's having homicidal thoughts or suicidal thoughts can, within minutes, get their hands on a dangerous military-style weapon and open fire. So, we've been engaged in some really positive conversations with our colleagues late last week and over the weekend. I think we're very open to a piece of legislation that would invest more in our mental health system, but also make changes to our gun laws. And that's my hope, is that we'll be able to do both.
Yeah, I think, our conversations are really at a new place, much more hopeful than ever before in recent years. Mental health is absolutely essential to America. Doing more and doing better in mental health is absolutely critical to addressing all kinds of violence, including gun violence. But there are steps that have to be taken to stop or reduce the epidemic of gun violence. And domestic violence, for example, can be caused by serious mental health issues, but it's 5 times more likely to be deadly to a woman if there's a gun in the home. Kids may have issues, but they are much more likely to harm themselves or others and even commit suicide if there is an unstored gun in the house. And people can be stopped from suicide, literally, if they are separated from guns through a court order in a red flag law. More than half of all gun deaths are suicides. And red flag statutes routinely, in the 19 states that have them, help prevent people from taking their own lives or others' lives. So there are steps we can take, red flag laws, safe storage, background checks, other common sense measures that help reduce the deadly consequences of mental illness. But treating mental illness alone is insufficient. It's necessary, absolutely critical, but insufficient alone.
Great. Thanks, everybody.
Thank you.
Appreciate it. Thank you.